This is the Grow My Clinic podcast by Clinic Mastery, where we help you deliver amazing client experiences to grow your clinic.
Well, welcome back to another episode of the Grow My Clinic podcast. My name is Jack O'Brien. Thank you for sharing your earbuds with us today. First of all, I want to say thank you for your reviews, ratings, feedback that we're getting through all the different platforms. We really appreciate that, and we love spending some time with you while you walk the dog or spend some time in the gym or wherever you listen to these podcasts. Today, we have a very special guest. We have Scott Willis with us from the Australian Physiotherapy Association and a clinic owner as well. Scott, how are you today?
I'm very good, mate. Very nice day down here in Tassie, so it's very nice.
It's always a nice day in Tasmania, isn't it?
It is always.
For those who are unfamiliar, Scott is the national chair of the Physio Business Australia, so the business arm of the Australian Physio Association. Clinic owner down in Tasmania for over 2 decades now, I believe, Scott. Is that right?
Yeah, that's it. We've just, as an owner, 20 years this year, it's just clicked up, and I've been down here in Tassie about 25 years. So it's been a good transition and a good journey as well.
Yeah, super stuff. So what we're going to touch on today, listeners, make sure you stick around till the end. We're going to be talking about how you as a clinic owner and in private practice can engage with your association, whether that's physio or other professions. We'll talk about some of the reforms coming in from a government level. We'll talk about advocacy. So there's plenty to get through today on this episode. But firstly, Scott, tell us, who is Scott Willis and what is your background, mate? What led you to Tasmania, or are you a Taswegian from birth?
Yeah, no, I come from Sydney, so I did my training at Sydney Uni and graduated back in '93, I think it was. And at that time, there wasn't a lot of jobs around in New South Wales, Sydney area, so found a little ad in Sydney Morning Herald that said Tassie wanted, physios wanted in Tasmania, so I rang them and they said, can you start tomorrow? And I said, give us a couple of weeks, and yeah, that's how it all started pretty much. And I just got into that groove of a rural area, community spirit, and I started to play sport down here, and just thoroughly enjoyed it. And then met my now wife, so that usually keeps you in an area as well. So got married and then set up a clinic with another physio, and it's grown quite well from 20 years ago.
Love it. And now your clinic is multidisciplinary, looking after some corporate stuff and Pilates. Can you tell us a little bit about Coastal Physio and what it looks like nowadays?
Yeah, so it's definitely multidisciplinary in a rural area. We don't know what's going to be walking through the door. We've got exercise physiologists, we've got new grads right through to APA sports physio as well. So we look at aged care, corporate, peds, NDIS. Multiple of things, anything that comes off the street that any clinic would see, we see it here on the northwest coast of Tasmania.
Yeah, and I guess that's the nature of rural practice. We have a lot of regional and rural listeners who would definitely have an affinity with that. It's whatever walks through the door, you're the answer, you're the solution. Scott, tell us about your role with the APA. What is that all about?
Yeah, so it started just being on I suppose the branch council of the Tasmanian branch council, and then grew to the Physiotherapy Business Australia. So I went on to their national committee, and now the last 4 years been national chair of that entity, and that comes to a close at the end of this year. So I've done my 2 lots of 2 terms, and I've now just been elected to the board of the Australian Physio Association, which will start the 1st of January next year, which is another exciting but scary times ahead. Another step up, but we've got to step outside our comfort zone every now and then.
I love it. Congratulations on your appointments, and it's fascinating that obviously I haven't been around forever, but to see the change and progression in our profession over the last 4 years under your leadership in the private practice space is fascinating. And I'm mindful that there's a lot of listeners here who aren't physios. If you're not a physiotherapist, there's going to be lots in this conversation that will be applicable across professions. We'll probably use physiotherapy as a case example. So can you highlight some of the changes in the business or the private practice world in regards to our association? What are some of the changes or things that you're really proud of over the last 4 years?
Yeah, look, I think we're really gearing. I think we're really gearing. Well, I think the association has really stepped back and thought private practice is really a significant entity within our profession, and we need to be able to develop the private practice, because I think in the future the private practice is going to be the major employer of any physio coming out. So I'm really, really proud of the APA as well, because they've taken it on and really listened to the members to say, look, we need to really develop this area, because it was underdeveloped, say 4 or 5 years ago. You know, the offerings were quite low, you know, and I think physio as a whole is very, very hard to think as physio as a business. I think, you know, at our uni, it was always, let's look after the patient, don't worry about the money side of it. If you're a good physio, you're going to make money possibly, but we all know that's not true. You can be a good physio and you can be a poor business person as well. So I think we've really highlighted that and really put a framework together and a pathway to try and develop a lot of the skills that are required for private practice, especially if you're in business as a business owner, but also as a new graduate, a pathway when you first come out to possibly to be a clinic owner. So I think that's our biggest thing, that we've really started to go along that pathway. And it is a journey. It's not going to be a short-term journey, and it's going to be changing, which with any entity, it's going to change, especially when you've got government and third-party funders involved. You've got to be flexible. You've got to be agile. And, you know, that's what we're trying to develop now, is that, you know, we're going to get the skill sets available to the private practice owners, that they can be mobile, agile as the policy and advocacy changes with it, which it will over the next 5 to 10 years.
Yeah, and I admire the ability of a large association and a large profession to embrace change. The reality is that some of the institutional elements are slow to move. Universities, with respect, are often a little bit behind the times, and often associations are, but I think the APA has made some really impressive strides. Scott, just to press on that a little more, what is the ratio of private practice to public practice in the Physio Association, and does that translate across to other professions as well?
Yeah, definitely. I'm not exactly sure about the percentage of it, but it's something like 65, 35 of private practices now, private practitioners compared to public practitioners, where you go back 10 or 15 years ago, it was probably the opposite. And even with the new grads coming out now, 10 years ago, it was 60% going into public, 40% into private. Now it's flipped completely. New grads now coming 60% out into new grads out into private practice, 40% into public. And I think another 5 to 10 years, it'll be up to 70% with the cuts and changes to the public system. There'll be more and more demand to go into private practices.
Yeah, I love it. On that, when it comes to being a private practitioner, whether you're a business owner or not, and a relationship with your professional association, if I can ask a candid question, why should a private practitioner be a member of an association? What's the benefit?
Yeah, no, very good question. And we often, sitting on a national group and a national committee, we often say, so why should someone join an association? Why should someone actually join even like a PBA or a sports physio group and things like that? And I suppose when you've been around, like I have for a significant amount of time, and seen the amount of work that goes on behind the closed doors in the background, that's when you start thinking, I'll pay whatever amount of money. If it's like, I think it's about $1,000 or something for a membership with your, with your insurance and things like that. It's a fraction.
Yeah, absolutely. So what are some of those things that you've been advocating for? Maybe speak to us a little bit about private health insurance reform, or even DVA reform. Yeah.
So I think what a lot of people don't realise is that, possibly there's some funders out there that were going to cut physio or allied health from being funded completely. And it was going to be a significant cut. And it was pretty much the APA that stopped that.
Sure.
And I don't think we bounce around and tell people that, because it's just something that we do. Other things is, with the Pilates funding and things like that, it's going to be stopping at the 1st of April. There's a huge amount of background work that's going on in that to demonstrate the Pilates is just a word. We're actually talking about an exercise component to a treatment. So it's just like a McKenzie, it's just like a Maitland, it's just like another bit that's the tool that's in your toolkit pretty much when you're treating patients. So there's those types of things. There's, the NDIS that's going through a huge amount of reform at the moment, that with the Quality and Safety Commission, with the accreditation issue that's happening. And only last week at a standing committee that the APA was represented very well by Jules Locke. And it looks like that there could be some movement there because of the cost that's going to be associated with accreditation if you want to be an NDIS provider. And then you've got your private health insurance with telehealth. We've done a huge amount of work over the last 2 years with the private health insurers, trying to get them to fund telehealth. And we're nearly there. It's just those background things that people don't see, where your money goes.
Yeah, I think, Scott, that's a really good summary, because I think there might be a perception out there that associations just stop things going backwards. So when you mention the private health around cutting physio or, stopping the profession going backwards, but I see the APA and other associations, let's be clear, the OTA do a great job, and APOD, among others, ESSA, really progressing our industry forward, not just professions, things like telehealth, really pushing that forward, and the education and branding and reform around what happens in university. I love the work that you guys do. And it's not just stopping things going backwards, which is a bit of a scarcity type mindset. The progress and push is awesome.
Yeah, definitely. And look, I think, the APA would be the first one to say, we have done some wrong things over the time, but I think every business owner would say that they've done it as well in their own business, that you can't stop doing things if you think that it's going to be wrong. It's a passion that you think that it's going to be successful. Sometimes it doesn't work out that way. Sometimes there's other parties involved that are going to stop that from happening. So with an association with over 26,000 members that the APA have got now, we can actually go to these funders and say, we've got 26,000 people. It's a big pool, rather than going and saying, I represent 500 people. There's a significant difference. Especially like we, the APA under the leadership of Phil Calvert, he can actually text the Minister for Health now. He's actually got a direct line to him.
Direct line. How good is that?
Where before there was no way that would happen. We have regular meetings with all the ministers and the shadow ministers, where before we would be very reactive, and if something happened, we would go and see them then. Where now we're going to them and saying, you think about this policy, how about we look at this way, because this might get you a better outcome. And they're starting to listen, There's been multiple of things that are happening, such as the rural workforce incentive program for GPs to employ physiotherapists or allied health out in rural areas in competition to practices that have already been set up. They did not see that. We went to them and they go, oh, we didn't even look at it that way. So they're actually looking at ways to change that. So, it's those types of things. So with regular meetings and regular advocacy and policy issues that are coming up, if you have regular meetings, you can actually set up before it happens.
I love it. And that's the fruit of years and years of blood, sweat and tears and labour and people chipping away across all professions. So that's super stuff. Scott, what's on the horizon when you look at things like, data collection or DVA, or what things should private practice practitioners, private practice owners be mindful of?
Yeah, look, I think the one biggest thing is it always comes back to this, and that's data collection. You mentioned it just now. When we go to a private health insurer, when we go to DVA, when we go to Medicare, when we go to NDIS, when we go to ACFI, and we say to them, look, how about if you fund physio to do this because we can save you so much money down the track? They go, okay, well, show us the data.
Sure.
And it's like where they go, Oh, but we've got the studies. The university's done the studies. They show that there's a 15% reduction in this. There's a study that shows that internationally that telehealth is, if not better than face-to-face consultations in the clinic. And they go, yeah, that's good, but where's your data for locally? I want show me where your data is locally. And we go, we haven't got it. So the APA is taking the biggest challenge now into actually investigate how we can collect data at the right place, the right time, at ease, to try and get some of this data. Now, the orthopaedic surgeons do it very well with their joint registry. Now, they can actually demonstrate what their infection rate is, what their length of stay is, what their complication rate is to the percentage. We can't do that. We can't say that, if a back pain patient comes to us, we can save the money, X amount of money, because of our intervention. We can't do that yet. So unless we can do that, our policy is a bit stunted. And I think it's every association. Every association out there has got the same problem. So I think that is going to be the game changer. If we can get that right, I think it will change the whole outlook for funding for all allied health.
And in light of that, what role do individual practice owners have to play? Is there anything that we can be doing better?
Yep. So what we're trying to get people to do is to actually look at what's the deficit that our practice software is. What deficits are there with our practice software? What can't we get? What outcome measures can't we say access? Can they use telehealth? Can they download the new patient registries and things like that?
Sure.
Can they have secured messaging? All those types of things. If they can't, ring up the vendor and demand it, because they're telling us that our practices don't want it. Or they aren't looking for it. Where I don't think practices know what they really need in the future, and that's what we're trying to develop now.
Okay, sure. Anything else on the horizon that's of note?
Yeah, just with the Pilates, we touched on it before. So the 1st of April, Pilates and also natural therapies will be discarded by private health insurance. So any natural therapy will not be funded at all. And I think this really demonstrates the government's appetite for high-value care, where it's got to be demonstrated to be of a significant advantage and benefit to the consumer and to the funder and to the government. So the APA are in the background trying to do quite a bit of work, and in conjunction with Private Healthcare Australia, which is the association looks after all the major private health insurers such as Bupa, Medibank, Private, St Luke's, all those ones. They're coming to bat with us. They still want physiotherapy to provide this, but we've got to try and get a way that is fair and equitable and goes along the lines of a medical model type of thing, not a fitness model. So we're working on that at the moment. The other things are just the DVA changing their treatment cycles. So next year you're going to have a referral every 12 treatments, I think it is, and you're going to have to write back to the GP. So it's very much along the line of the EPCs, that type of thing as well.
But do you see any change in the EPC program? I know that's probably a burning question from a lot of practitioners.
Yeah, look, I think if we have a change of government, we may.
Federal level.
Yep, at a federal level. We may see a change there. It's always on the table and has been on the table. And I suppose this is where the background negotiations and the background lobbying is really, really crucial for all organisations, because it is on the table. It has been for the last few years, and there has been more and more mutings. If there's anywhere in the government that they want to save, this is one area that, especially, again, we've got no data. We can't demonstrate anything. We can't demonstrate what this is achieved. We can't say to them that if you keep funding EPCs, our osteoarthritis rate will reduce by 15%, or our chronic disease management improves by 30%. We can't demonstrate that. So that's what the government are looking for: is okay, what we're giving you X amount of millions of dollars. What are we getting in return?
It's all about that ROI.
It is. It certainly is.
It's funny, isn't it? Like, you mentioned right at the top that we get into private practice, we get into healthcare because we care and we just want to create great outcomes and great experiences. And I think as we continue to do that, but not stop there, but provide the data that our outcomes and experiences do provide a return, things like advocacy with the government becomes easier, and things like the commercial reality of running a practice and making money and making a healthy profit. It's not evil to make a profit. It's a reflection of the value you provide. But as we stay focused on our patients and doing the right thing, the rest flows as a natural expression. So is there anything else, Scott, that you'd love to say to private practice owners, our listeners across all professions? How can they better engage with their association? What words of wisdom, any pearls of wisdom from the great Scott Willis for our listeners?
Yeah, look, I think it's get out there and just make contact with your association, especially at a local level, and then possibly at a national level. If you don't understand why the association is going in a certain direction, go and talk to them. There's always people that are willing to talk to you. I know when I first started, I'm thinking, why on earth are they doing that? When you start looking at the bigger picture, you start thinking, my God, there is so many other things that are happening in the background. That's why they've got to do it this way. We can't just go into a minister's office and start demanding. We've got to set up those. It's just like business. You can't go into an organisation and say, I want to provide physiotherapy to your corporation. You've got to actually get their trust. You've actually got to demonstrate your worth. Your commercial reality to it is exactly the same with that. So, it's those types of things. I think that if you get involved with an association, you actually see it, and you start breathing it. It follows through into your own business, or even into the public system, into your own culture in your workplace as well. So I think it's just try and get involved, try and have a look and see what's happening. It's not everyone's cup of tea to get involved in a committee, but it's also just about actually knowing what's happening, I think is the biggest thing. And that's with social media now. We're trying to get that out a lot more now with the Facebook pages and LinkedIn and all that. So it is getting better, and we've got to work on other avenues or other ways to get this information out to members as well, because it is hard. We get so many emails now and so many bits and pieces that come across your desk that there's got to be other ways that we get the information out.
I love it. For me, it speaks to that mindset of clinic owners. We expect our team to not just be consumers, but contributors. And yet sometimes we sit back and I think we don't have a right to whinge unless we've contributed. I think the listeners of this podcast are pretty open-minded. And so I think that encouragement of having conversations, get involved and get to know people. We don't have to, sign up for hours and hours of volunteer work on a committee, but get to know. It's who you know, not what you know. So that's awesome. So I want to honour you. I know on behalf of Clinic Mastery and our listeners, we really appreciate all the work that happens behind the scenes. The years and decades of contribution from yourself is really appreciated. And we're really stoked that you could join us on this podcast. If people want to check out your clinic, where should they go? What website?
Yeah, so it's coastalphysio.com.au down here in Tasmania on the northwest coast, and then also the PBA Facebook page, and also the new Physiotherapy Association's website as well. So they can check that out as well.
So to be clear, that's www.australian.physio. Is that correct?
Physio, that's correct. Yep.
Awesome. And the PBA Facebook group is APA PBA. Is that correct on Facebook?
That's it. Yep.
Awesome. Scott, thank you so much. Listeners, all those will be linked up in the show notes for you. You'll find those over at clinicmastery.com/podcast. You'll be able to check out all of the resources mentioned today. Thank you so much for sharing your earbuds with us. And again, thank you for your reviews, ratings and feedback. They definitely do not go unnoticed. And Scott, thank you so much for joining us on the podcast today, mate.
No, thank you. Thanks for having me, and have a good Christmas if I don't talk to you in the meantime.
Thank you so much. Listeners, have a great day. We look forward to bringing you another episode again really soon.
This is the Grow My Clinic podcast by Clinic Mastery, where we help you deliver amazing client experiences to grow your clinic.